So a lady just called me for ketamine troches for at-home ketamine-assisted psychotherapy. She's been doing at-home ketamine, but her previous provider was sketchy. She mentioned taking training for this, but never having a client. My ideal is to have a therapy session first to set intentions, goals, and expectations. During her at-home session, I want her to document new perspectives/metaphors that occur to her. And that evening, I want her to journal insights gained, emotional or thought shifts, integration questions, and reflections on goals. She has a therapist. Is it reasonable to ask her to journal and make forms and review them each month or each week to make sure she's getting the full benefit? So let me say a couple of things about this. One is that I would just be sure you feel extra comfortable prescribing this patient the ketamine troches and that she's going to be safely using them at home. It sounds like the plan is for her to do it at home by herself and then discuss it with either you or a therapist in session. So not doing it guided over like Zoom or something like that while she's taking the troche. Typically, ketamine-assisted psychotherapy is time limited. It's not the kind of thing you just do for months and months on end, because you want to make sure she's not just using ketamine because it makes her feel good, right? It has dissociative effects. It's definitely abused. So I would just be very clear about why the patient's using it, like what was sketchy about the last provider, how many times has she done it, what's the goal of the treatment, what's an appropriate number of sessions. Pretty typically 6 is the number of sessions that are often done for ketamine-assisted psychotherapy, and you feel confident from a medical perspective that it's safe. You might have her have like an at-home blood pressure cuff and just check blood pressure in the middle of the session to make sure the blood pressure is not too high. Make sure that there's no other, medical contraindications to using ketamine, especially using it by herself. As long as those things are fine. The second part sounds very reasonable to me. The way I think about any kind of psychedelic assisted psychotherapy is you want to know what you're working on. You want to know what success is. It's most useful when there's some sort of struggle, whether it's trauma or just current life struggle, that the person is hitting blocks against in regular therapy. And they want some additional help to make new neuronal pathways, to have new insights, to have new ways of thinking. And so what I do with patients is very similar to this. I'll have a session with them that's like a prep session. We talk about their goals, what they want to get out of it, those areas of struggle. And the way I phrase it is like, imagine you have access to the highest version of yourself for a couple of hours. It's still you, but like the most insightful version of you that just sees everything clearly and without all the noise in the background. What would you want to ask that version of yourself? And I have them write down a list of like 5 to 10 to 15 questions. I like to write down those questions or have them document them and send them to me so that way I can ask them those questions during our follow-up sessions. Because often what the subjective experience is everything just feels a little bit more clear. We all have multiple voices in our head, and I don't know, for those of you who have used psychedelics, it's like, oh, these noises quiet, and then this one becomes like much more clear, and you have just that version of yourself you might only have access to for like a few seconds in a day, or a few minutes you have access to for a couple hours straight. So yeah, as long as you feel like all those things I mentioned from a safety standpoint are good, I think this is totally appropriate. That's what I would do as well. Even just having them fill out those forms is useful, because in like a year from now, the patient may forget some of the insights they had, and you could remind them, like, remember when you struggled with this, but you came up with this answer in your home ketamine sessions? Oh yeah, I didn't remember that. And so it's just good for you to have that documented so that you can help remind the patient of those insights.